ICRIS, the new group health insurance. This is a special program for the Broomfield Chamber of Commerce. Individual coverage HRAs, ICRIS, the new group health insurance. What are they and how do they work? Individual coverage HRAs, ICRIS, are a new type of employer-sponsored group health insurance that allows employees to buy most ACA-approved individual health insurance plans and Medicare on an IRS-approved, tax-free basis. There are typically three reasons to purchase an ICRA. One is choice. ICRAs allow employees more choices in both plan types, plan costs, different classes, and doctor networks. The second is cost. Individual plans and Medicare cost far less than their equivalent traditional group choices in most parts of Colorado. And third, employers set the contribution on how much they want to spend. And secondly, the employee chooses the plan that they want. And this works out well for everyone. Let's look at choice first. Choice. Employees can pick whatever individual plan they want in their home area, including Medicare. Some can opt out and choose tax credit eligible plans on the exchange. No more one size fits all. ICRAs have a lot of flexibility. A carefully designed ICRA can allow lower paid employees to opt out and get tax credits on the exchange or Medicaid, while allowing higher paid employees a wide selection of tax-free choices. They can also choose to go on Medicare. With ICRAs, you have a lot of flexibility in which class of employee that you want to cover. You can also do mix and matching. You can cover full-time, part-time, salaried, non-salaried, people just in a specific geographic area, unions, seasonal employees, temporary employees. You've got a lot of choices on how you want to cover different classes with different amounts of payment. Cost. Savings is a big part of ICRAs. Vericred and Milliman did a large study for comparing individual costs versus group health insurance costs across the United States. There's an interactive map that your broker has available for you where you can actually look county by county to see where the differences are. In general, Colorado looks great, with almost every area of Colorado being less expensive than group on the individual market. Determining how much savings you'll get is best done by simply getting a quote. Pictured here is a page that allows you to set up your employer portal and run that quote. The link is on the Broomfield Chamber of Commerce homepage. Chip Murphy is also here to help you along the way. Once everything is set up, employees can actually enroll by using the button on the left. The third reason employers like ICRAs is that the employers get to specify an amount of the contribution for the employees, and then the employees get to pick whatever plan they want. You now have separation between how much the employer is paying and what the employees choose, and this really helps for controlling costs in the long run. Employers can now set a company contribution. Typically, it's either a lump sum or a percentage of a reference-based plan. We think going with a percentage of a reference-based plan is more similar to traditional group and health insurance, and it doesn't discriminate against older employees. Then the employee can pick the plan from well-known names such as Anthem, United Healthcare, Bright Health, Kaiser, and on top of that, they can also use Medicare if they're Medicare eligible. ICRAs are a little different in that the employees can pay for their own policies or the company can pay for them. Generally speaking, we find it's far better if the company pays for the policies directly. It eliminates a lot of the paperwork involved with things. Employees don't have to come up with the money up front to pay for their policy. And they don't have to worry about them not having enough money to pay for their policy later down the road and losing it for non-payment. Lastly, ICRAs require a system to process efficiently. Typically, an employer will set up an employer portal with the help from Chip using the link provided on your Broomfield Chamber of Commerce homepage. Once things are all set up, they can give their employees the 90-day notice that will explain everything. Plans can be started much quicker than 90 days. due to COVID-19. Employees will shop for a specific plan and roll through the system. Chip can discuss their options. And then finally, everything is entered in the system and the payments and payrolls for the employees are adjusted accordingly. People have found that it creates great results for both employer and employees. Thanks so much for listening to this whole presentation. I hope you found it worthwhile. Sometimes it's easier to just get a quote. So all we need is a simple sentence and an idea of how much the employer wants to contribute, and we can get one to you right away. Have questions or need a quote about ICRAS? Just talk to Chip Murphy at Kelmeg & Associates. He'll be happy to help you. His number is 303-466-9575.